AI in healthcare. In a current world scenario, artificial intelligence is playing a main role in a healthcare industry. AI, the word which is coined by the Jan McCarthy. The artificial intelligence. What is artificial intelligence? It is the ability of a computer or the computer controlled robot that perform the task that are associated with the intellectual process characteristic of a human. It like a mimic like a human. This artificial intelligence in a various form it is being administered in various department of the healthcare industry. It is like a deep learning as well as the machine learning and AI, which is mainly working by because of algorithms and CNN. What is CNN? Conventional national neural network. This how our neuron biological neurological system how it is working same like a imitation. Artificial neural network, artificial neurons, like deep learning and cloud technology has been mostly used for the drug company and processing and storage and manage and access the data. Cloud technology is helpful to data management in the administration also. If you take these technologies like algorithm, deep learning and this one in the air, we will see about what are the areas AI is working. AI is like mainly helpful in a medical diagnosis department. It is how it is like a CT MRI scan. It is actually predicting and finding out where is the problematic area has been highlighted for the easy learning decision making by the clinicians. It is very quick and it is not wasting the time in more accurate and making electronic health records more easily, and every time it is much accessible. E- and it is also the accurate for the cancer diagnosis and detections. Cancer is a yearly prognosis, like a fast growing disease. Yearly diagnosis will be helpful for the yearly prognosis. And AI drug discovery. If you see in the world, 1.3 billion was spending about the cost per year for finding out the new drug. The deep learning technology of the machine of AI technology has been incorporated. Thousands of human hours are spent wasted. Here it is saving thousands of human hours and helps to design the drugs and also the select the ideal candidates for the clinical trial and also monitor the biological signals correctly for the sign of harm or the death, what is happening, the drug side effects, everything immediately. The real time data has been clearly given to the investors. And about AI robotic surgeries, current days it's very common and very famous and most widely accepted surgeries or robotic surgeries. This robots is the machine have a forearm, it is freely moving. In between the surgeons, it is showing the magnifying imaging images and highlighting. It has got the forearm which is freely moved. The surgeon can sit seated at the computer console room and he can operate it. This all doing the minimal invasive procedure to the open heart surgery. Speedy recovery is there, minimal blood loss, less hospital stay, so the healthcare cost is reduced. It is one not only by the surgical, it is also in a general ward AI playing main role. It is automatic monitoring the vital signs of the patients. If anything goes wrong, calculating the warning signs in a early manner, sending the signals to the physicians immediately to find out the deteriorations and prevent the complication. Monitor the cardiac patients remotely for timely diagnosis for the treatment and care. Actually speaking, it is helpful for the fitness diagnosis to the post treatment monitoring also it is helpful. AI data management. If you see the AI data management, it handles the massive volume of a data. It helps to break down the data in a minimal for massive volume of the data. How many patients totally coming? Also in a age specific patients of admission, age specific or disease specific admission, and monthly admission rate or monthly disease rate, drug rate in any specific data in a within a second. It processed by using the cloud technology. It's bringing back the data in accurate format, and it is useful for the administration process, and it is also time saving and cost effective. It helps to the data analysis management of the medical records, keeping the medical record for the ever. It is very important. After few years, it is converted into microfilming technology. It has been stored in artificial intelligent or by using the cloud technology. So it is fitness to the diagnosis and the post treatment and monitoring also it is helpful. This is about okay this and this also ward management we have seen, and data management also it is very important. And in a personalized manner, AI is the patient experience, everything is the customer satisfaction is very very important. If you take customers, they have many devices has been, many companies came forward, made a very 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 much good devices. So these devices will be wearable by the patients, it is connected to the mobile networking. So uh, it is remote, like it is helpful to monitor the patient's progress. Also it is, for example, some butterfly network design, it is connecting to the mobile phone. It is also giving a 3D view. If anything goes wrong, immediately the image it is sending signals to the surgeon, to the doctor. And it's also remaining the schedules and a reminder, scheduled reminder, it is telling them, and the medication reminder, it is giving the health tips. You are not walking, it is the time you long time sitting, long time your mind, it is also useful for it's also calculating your emotions. So it is helping you, and it is giving the signals. You will not believe it, it is also giving the end of life care. End of life care also, in the patients about to die, what is their emotions, how long, how the body, it is giving this one. And genetic research, genetics, genes codings and gene therapy. So the genes, nowadays the healthcare industry helping to correct the gene modification or gene corrections. They've identified the genes, it's very much helpful by the artificial intelligence. Then artificial intelligence also helpful in a public health. If you see the public health disease surveillance, and then the role in a epidemic or pandemic, immediately sensitizing and giving a warning sign, and its role in screening and role in a water treatment. And sustainable developmental goal, the goal number 4 is education. It is customized teaching and automated teaching also given by the AI. And if you see deep learning is like a computerization with the multi-layer neural network, it's called the deep learning really, which is helpful. Deep learning is really helpful for many things we have seen, like a drug diagnosis and the MRI scanning and other things which is doing. And then this ML, what is called this machine learning. The machine learning is a statistical and evolving giving the new experience, and coming with experienced data has been given. AI is like a mimic like a woman, it's enabled like a characteristic like a human being. This is a final one. So all these things. And AI also used widely by the nursing professionals. Nursing professionals are nowadays working in a service side. It is also minimized in the like patients minimize the drug error has been minimized. And also in a service side, maintaining the electrical like a record, electronics record, health record, patient health record, and writing about the care plan, and helps into the nursing diagnosis. And easy to diagnosis, reduces the workload, and real time management can be done by the nurses and immediately. And the education side also helpful to collect the data and doing the research work, and education contributing the much data, and robots involved in this research studies were the higher studies and education what they are doing it. And the research from the statement of the problem to finding out this one, evidence based research also helpful, bring out the in a minute it is bringing 1,000 and 2,000 research data are coming. So the nurses can involve in a meta-analysis, systematic reviews, they can go for the evidence based practice. Administration also much helpful in making the patient, making the nurses leave record, nurses leave management system. Many this systems has been implemented by this one. And nurses also easy accessible for the data, by putting their own ID card they can easily accessible. Only thing nurses has to know have the computer knowledge. So today we have seen clearly about what is AI. And 1955 he coined, John McCarthy, he is the one is called as the father of artificial intelligence. In this class we have seen about what is the machine learning or the artificial intelligence. This is nothing but the machine can predict, machine can comprehend, and machine can learn, machine can act like a human being is called machine learning or artificial intelligence. So artificial intelligence is a various form. What is this challenge? Mainly we should have a high speed internet data available, and this all various technologies has been incorporated. We have to learn, either the doctors and nurses and the companies robotic people will be coming, and the technology has to be understood, and we should have a ready to learn. And most widely used technologies are the cloud technology, and deep learning technologies are also used, and also robotic surgery is also used in a higher level of treatment services. Most people liked it also. So in this class we have seen clearly about how the AI worked in a medical diagnosis and the drug discovery, robotic surgeries, AI data management, AI used in general ward, AI used in a personalized care, patient's experience. Patient can learn about some questions, the AI can answer it immediately, solve the problem. AI can give an tips, health tips, and AI also useful in a public health. And we have seen all these things also useful in the nursing. And also there are some challenges are there. AI is implementing is really, it is high cost. Sometimes people fear for the losing their job. It is a very new concept. Old people, old employees, it's difficult to accept and adopt the new technology. And lack of internet facilities areas, it's very difficult to implement it. And safety is concerned, and who is responsible if the AI machine or which cause something harm. It is very important. The first robotic process, first robo is called the Sophia. Sophia robo is a socially intelligent humanoid robot. That is the Sophia robot was created. Socially intelligent humanoid robot is called Sophia. This Sophia was answering in general question. Now after some years it was invented fast, and now the mini robots are there. They are really supportive in the surgical areas, like surgeries. It's helpful for the surgeon, so they can perform, surgeon can perform n number of surgery. If a surgeon is doing only 10 surgery, he can double the amount if the robo is really helping him. Both patients also benefited. If the cost is healthcare cost, if a third party payer is willing to accept the robotic surgery, then cost also going to be effective for the patient and the consumer and the healthcare industry. Thank you.